We're all right, so we're recording now. Hello everyone, to those who are watching, and welcome to episode one of the Globally podcast. Today I'm gonna be your host. Matthew and Sign, my other hosts. We will be doing frequent interviews together, but not for the first one. The person I'm here with today is my dad, who is a doctor. Hi, Dad. And our
Hello.
topic today will be good health and well-being. All
Great.
things considering, he's a doctor too. So, Dad, why don't you tell everyone a little about yourself first?
All right. I'm double board certified in both head and neck surgery, otolaryngology, as well as facial plastic and reconstructive surgery. I've been in Jacksonville for 15 years. After I finished fellowship, we moved here as a family, and I started a practice. It's called ENT Specialists of North Florida, as well as Meier Plastic Surgery. So basically, I have two boys. Liam is one of them, and we are, I guess we're going to talk about global health issues today. So great.
Yeah. Thank you. That's a lot of accomplishments. Let me just start off with basic questions, Dad. So, having to do with global health, do you know of any like global health issues we have today?
Yeah, actually, there is a fair amount of global issues today. I think, if we think about in the past 3 years, one of the major global issues was obviously the coronavirus or COVID-19 infection that started, back in, 2019, and then basically affected all of the world because of communicable diseases. It affected travel, it affected industry, it affected health. And we had to shut down the hospitals and surgery centers and clinics for about 6 weeks for two different separate times. And so I think that's one of the major ones, obviously. And luckily, since we've had some immunizations and other things across the world, that's less of a problem now than what it was then. However, coronavirus infection is still affecting many communities, and people still are dying from it, especially in third world countries. So I think coronavirus is a key one, but any communicable diseases. So there's HIV is a big problem, not as much in America where we have access to drugs, but also in third world countries primarily because they do not have access to the expensive drugs that can kill some of these viruses. That's the same thing with coronavirus, which Paxlovid is a medicine that they use to fight coronavirus, or we use for infection for coronavirus here. That's not even available in many countries around the world. So the poorer countries, or what we call third world countries that aren't as industrialized, don't have access to healthcare. And I think that's one of the best global access and global issues that can be talked about when we talk about global health is what part of the world has access to certain types of healthcare, even like routine medical care, blood pressure medicine, insulin for diabetes, access to medications, access to surgeries. Those are all very important as when it comes to what I call global health initiatives. And then obviously, certain diseases affect other communities more than others. So we have malaria that affects more in the tropics, and that kills a lot of people every year. Tuberculosis affects all third world countries for the most part and would affect us here. But a lot of countries that are more industrialized get vaccinated against tuberculosis. So, and here we test it and make sure that it's not present. Measles is making a comeback in the United States. So vaccinations have laxed recently, whereas less children are becoming vaccinated, even in industrial countries like United States. And so measles and other communicable diseases are making a comeback even in places like here. So I would say right now, global health initiatives can be, in medicine at least, a lot of communicable diseases and access to health, I think, are the two most important things.
Oh, yeah. I gotta say, I think you definitely answered like some of my other questions that I was gonna ask you.
Okay.
Pretty much about like why everyone should be concerned about global health. I mean,
Oh, well,
you
let's talk
answered
about that.
that
Yeah.
perfectly, but okay,
Well, we
yeah,
we we answer it because everyone should be concerned about it. So let's take the coronavirus infection by itself. Is that can spread certain communicable diseases and viruses can spread all across the world, and if they do that, they can affect everyone. People were dying, primarily the elderly and also obese and sick people. Um, and those people would get hospitalized because they had what we call comorbidities. So, comorbidities in medicine or in medical terms means you have other diseases that make you more susceptible to certain things or make you sicker, basically. So, if you're sick and you become more sick because you got a virus, then those people can be life threatening, and something that could be treatable in a kid may not be able to be treatable in someone who's overweight, has high
yeah.
blood pressure, diabetes, and it has other health problems such as heart or lung disease. So it affects everyone. And I think it would be hard pressed to find someone in the United States or even around the world that doesn't know someone who died of coronavirus. So whether it was a relative or was a friend or a friend of the family, everyone knows someone who's died of that virus because it affected so many people.
Okay. So do you have, I guess my next question then would be, do you have any more solutions for these like global health issues that you've named? What would you do for a person in your field?
Well, so let's break it down to let's talk about viruses, okay?
Sure.
So I think one of the main solutions to viruses is vaccination. So I remember going into the hospitals myself and taking care of patients who we did or did not know they had coronavirus because the test was pending. Initially, when people had coronavirus and were sick, they just came to the emergency rooms and they had respiratory issues, cough, cold, congestion, fever, kind of symptoms that are very similar to pneumonia or influenza, the flu. So back then, there was no vaccinations. And so many physicians, not much just myself, but a lot of physicians risked their lives. And we would have to wear special helmets, what we call PAPR, which are positive airway, almost look like a spacesuit to go in to see patients and treating them. And so when the vaccine came out, and we were required to get the vaccine. So what if we wanted to see patients and practice medicine, the lost data we had to get the vaccine. I was happy to get the vaccine myself, as well as for our family, because the vaccine allowed us to be a little bit more protected. So it didn't mean that we wouldn't get the disease, and nobody really knew that the vaccine was going to prevent you from getting it. But what we now know is that the vaccines in the 2-dose or 3-dose series prevents you from getting really sick from it. And most patients who've been vaccinated don't get severe disease. Now, that happens with everything. So that happens in all aspects of all viruses for the most part in which vaccines are available. Like we talked about measles. Measles was eradicated when I was a kid. There were no measles cases in the entire United States. Why? Because we had vaccines and every kid was required to get the measles vaccine before they went to school. Mumps, rubella, all those things have been eradicated around the world for the most part. But malaria is another disease that's transmitted by mosquitoes, right? And there isn't a lot of good vaccines against malaria. So not everything can have a vaccine that'll fix it. There's no vaccine for HIV, which is human immunodeficiency virus. There's medicines to treat it. There's preventative medicines for malaria, but there's really no true vaccine for it. And so I think vaccines are important across the world because for simple diseases that couldn't cause, measles used to cause a lot of deafness. So in the ear, nose, and throat realm, people would get measles as a kid and they would have permanent deafness from that. And that's sad because that's preventable. So, but again, not everyone has access across the country or across the world,
Yeah.
especially to vaccines. And so I think that's one of the most important things that needs to be addressed is how is it exactly that we are going to give vaccines that cost a lot of money to develop and cost a lot of money in research and time, how can we make those more affordable for countries that can't afford them right off the bat?
Well, do you
And
have
in the
any ideas?
coronavirus, well, in the coronavirus, what we did is there were cheaper vaccines and there were more expensive vaccines right off the bat. And then once the population in the United States had the majority of the vaccines, and even before they were completely, high levels of vaccination in the United States, a lot of the companies were donating or selling that, or even the United States itself, the country itself, we would donate and or sell the vaccines for less expensive price than what we would pay for it here. We do that a lot with drugs. Drug companies develop the drugs. We in the United States, we pay a lot of money for those development of those drugs and the new drugs that came out. And then once we do that, because we are a wealthy country, other countries don't have to pay quite as much. And I think that's fair because they could not afford to do that on their own, given the cost of what it is for these medicines, including vaccines. So the only other way to do it would be to basically make certain vaccines or things that are important around the world have a cost restriction on them. So that instead of a company charging $100 or $200 or whatever the cost would be, that and these important vaccines at the maximum they could charge would be like $5. And with that $5 vaccine, they would still make money on it because they're going to sell it all over the world. But, obviously it's hard because companies have to make profit and they have to report to their shareholders. So it's not an easy solution. It's not like a one fix. You can snap your finger and say, okay, everyone, go ahead, get, vaccines, and we're going to give them away from the United States to every other country. It's not quite that simple. Also, education. Even in the United States, a lot of people are not educated properly about the power and benefit of vaccines. So if they're not educated, then they don't give it to their kids because most of the vaccines are given in childhood. So it's the parent that needs to be educated so that they can help their children out. But there was polio. Polio was a disease that was very problematic earlier, like in the 30s, 40s, 50s. Even President Roosevelt himself developed polio and he became paralyzed from that. Well, guess who gets polio vaccines when you're a kid? Pretty much anywhere around the world. Everyone. And so then people, even though you're exposed to maybe some polio occasionally, it won't cause the debilitating illness it did. So there's a lot of things about solutions that can be helpful around the world, but they're just not simple solutions.
Yeah. Adding to that, I loved your answer. So how would you say, how does really culture and social factors like impact the healthcare in different countries based on from what you've seen as a doctor and from other doctors too?
Well, cultural aspects and social aspects play a lot.
Yeah,
Also religious. So religion, culture, and social aspect. I think it's also education that goes into there too, because
yeah,
not everyone. So let's say an Amazon tribe doesn't have access to the same education as someone in Europe or the United States or Canada or somewhere like that, because
sure.
they're living in a jungle environment. Yet they still need to have knowledge and access to some of the vaccines that can help prevent diseases in those regions, or medicines that can help them treat or prevent disease in those areas, such as malaria.
Yeah,
So outreach is important. Outreach is done by world organizations. The UN, United Nations, does
United
it.
Nations.
There's an organization called Doctors Without Borders. They also go around the world and basically work for free. There's surgeons who go around in different types of surgery, and they do surgery around the world to help people. But that's all education. And so even though everyone has different cultures and religions and beliefs, and they may not quite understand all the benefits of some of these things, you can provide help and education at the same time to cure things and give vaccines. But again, there are differences in cultures. So some
Yeah.
cultures may not think it's great. They may not believe in shots. They don't understand
Or
what
medicine.
they
Yeah.
call Western medicine. Western medicine is a lot of pills and shots and surgeries and things like that, where they may be more holistic. Maybe they want to treat it with herbs, or they want to treat it with other things. And there's nothing necessarily wrong with that, because you have to respect people's cultures and ideology. But at the same time, we also want to benefit the world, because we don't live in an isolated world.
Yeah. You're completely right. So and adding to that, so as a person who you work with or for, I don't know, correct me if I'm wrong, for North Florida surgeons. Um, so how would you say, like, um again, with all of that, how would you say that being collaborated with them, the other doctors and the other healthcare systems, even, let's say, how does that strengthen the global health even more?
Oh, well, collaboration is key. So there's collaboration on a local level, all right, where different physicians collaborate with each other about patients, right?
Yeah.
So if a primary care physician or another surgeon may send me a patient because I have a specialization that I can help that patient with, and they don't have that knowledge or specialization. And the same thing goes with me. I send patients all the time to different specialties, such as endocrinologists, spinal surgeons, brain surgeons, neurologists, things like that, because I don't do those specific things. So on a local level, collaboration is important for global health, and because individual health is better taken care of when we collaborate. So when we communicate and talk to each other about complex things. But that also can be done more on a community level. So there's community medicine that's done. There's a program called We Care here in Jacksonville, that offers free clinics to people who cannot have access to things. But even that is on a global level, because again, communities are intertwined. Our local community is intertwined with the state of Florida and what's going on in the state of Florida, but also with southern Georgia, which is right north of us, and also some of the other bordering states. Things that affect us in this region because of the environment we live in affect other people in this region. And then, but even, what affects the United States can also affect Mexico and Canada. What affects Europe can also affect, Eastern Europe, Russia, Ukraine, even Turkey and the Middle East. Again, things are regional because of how, communicative diseases can spread through airplanes. We all take airplanes, we all go on flights, we all travel around the world. And so things can spread, as we saw again, like in
Yeah,
the
someone
COVID
can catch
19.
something just like that.
Yeah, on the airplane, or someone brings it to the country. So all the communities are interconnected, and they're interconnected with disease prevention. They're interconnected with access to healthcare, and we can all do a better job, including myself, but everyone, in providing and educating and doing some of these more interconnected trips, where we donate our time and efforts and resources and knowledge to help other communities in not only just their education, but also in the individual health, doing surgeries for free, doing taking vaccines, administering vaccines, um, doing just well screening, like, newborn hearing screening. There, in the United States, every newborn gets screened for hearing loss. Okay.
Yeah.
And that's when they're born. There's a specific screening test. Well, that doesn't occur in a lot of countries because they just don't have access to it. If we learn that a newborn has some hearing loss and we can fit them with hearing aids at a young age or a cochlear implant, then those children don't have to be deaf and can learn to speak and can basically even communicate almost normally, with certain technologies and things. But if you don't screen them, if you don't give them the newborn hearing screening, we'll never know who needs the technology. And even the technology, something as low as hearing aids, can benefit someone to at least communicate in their environment. Because if you're completely deaf in this world, I mean, not hardly anyone speaks sign language. And so, if you're completely deaf and have no other way to communicate beyond sign language, then you are isolated from certain aspects of the world. So, even though we have technology that has closed caption and things like that. So,
Yeah. Um, I want to make sure I get into the well-being aspect. Even though we've already talked about that, and health and well-being, they kind of go hand in hand a bit. I just want to make sure specifically about well-being, even though it's not in the direct area of or line of your work. Would you just say being just specifically about well-being of society, has that gone to like a turn now? How maybe considering technology, for example, our environment, the people around us, um right now, how has that just affected our children like me like globally around the world?
so you talking like not health well-being, but emotional well-being or physical well-being or both?
I would say a bit of both, yeah, physical, emotional. Do you just think that's taken a turn over the course of decades that you've
Well, everything
been working?
changes. So
Yeah,
when I was a teenager, I thought my parents were old and they did things the old way, and we had new stuff. I mean, when I was growing up, the iPod came out. And we thought the iPod was the greatest thing because you could store music on it. Prior to that, we had to use Walkman, which was a tape cassette that was like this big, and you actually had to carry around the tape around in your pocket, and is a pretty big thing. So an iPod, which was a lot smaller and could do music. But with any technology, there comes challenges. And so obviously, you have growing pains with the new technology. So now we have social media. And social media is great because it allows people to connect, but it also is not so great because it allows people to connect on an intimate level in your life all the time.
right. It
And
can
there's
influence kids like me to do like um pretty bad things.
Well, it can influence people to do bad things, but it also influences people to do stupid things, But more importantly, bullying can occur through social media. And so
Yeah,
that affects people's, I think, emotional well being, especially teenagers and young adults, but it occurs at all ages. It occurs in adults too. Um, Social isolation. If you're not physically engaged with someone in person, then it's hard to engage with them through the Zoom call always, and it's
yeah,
hard to really have friends. A lot of people have quote Facebook friends, but are they really your friend? Would you call them up, all of those, thousands of people, and invite them over for dinner on a regular basis or want to hang out with them on a regular
yeah.
basis? So I think that social media has excellent things that are done,
But it
but
also
can
has
also have
a lot of
issues.
cons.
The same thing would be like for physical well-being. So I think that as we use more technology, we become a fatter society or an overweight society. And with that aspect, there's heart disease, there's diabetes. Now there's certain drugs that people can use as an injections to basically make them eat less and make them less hungry. But we've had a variety of different technologies and surgeries, gastric bypass, in order to fight this wave or epidemic. And it's primarily an epidemic in America and as well as in other industrialized countries because
Right.
food is easily accessible to us. A lot
Yeah.
of countries have poverty, and and they are just doing what they can to eat enough calories in a day, and they're super skinny or they're malnourished. And so malnutrition, poverty, starvation, those things still occur in this world. And so I think that the good thing obviously about social media is it helps with that. The bad thing about technology in general not just social media, but technology in general, is it makes us a little lazier. Like my parents and my grandparents were not overweight their entire life because they worked. And most of the work back then was physical labor. So you worked outside, you worked doing manual labor, you burned calories, or you exercised. All those things I feel like, are becoming less and less. People don't get out, they don't go running, they don't take care of their bodies and their minds. And so, I think overall, I mean, we all say that, oh, things were better back in the day. My parents used to say that. I'm sure everyone says that. But in reality, it's much better now, but it's easier. So you actually have to take the time to dedicate it and be knowledgeable that not everything you read on social media is true. Not all of it should affect you. You have to, the news, think of the news. Where you
Big
get your news
influence.
from is different than where I've ever got my news from. The
Yeah.
news used to come from two places when I was growing up.
Now we
One,
get news everywhere.
local news on the news TV channel. So it had a TV show, but it's 30 minutes long or an hour, and it gave you local news or national news. And
Yeah.
there was only like prior to cable, there's 4 or 5 local channels. And after cable came out, maybe there was like 30 channels, and now there's thousands of channels. And
Yeah.
so, and then you also have all the podcasts and social media, and you have to be
Yeah.
careful what you read because you really don't know the source of things
Yeah.
automatically. So I think people, adults, children, everyone have to be more skeptical of what they're being told because, we've learned that certain media companies or things like that may have an agenda. Fox News has an agenda, CNN has an agenda, NBC has an agenda. And so they only may give you certain viewpoints of a story
Yeah.
and not just the facts.
Not the
And
full
so,
thing.
yeah, so when you get just the viewpoint and you're only hearing it from one side there, but there's always two sides to every story. And so it's it's
Correct.
it's good if you read from different sources. So
Both
don't get all your
sides.
information from one exact source, and especially, how much news are you going to get from a Instagram or a TikTok post? Probably not a lot. And,
Yeah.
people do like, even, there's some examples of people saying stupid stuff like, Donald Trump saying basically inject bleach into your veins to kill the coronavirus or something like that.
Yeah.
Obviously, he was joking about it, but, people picked up on that and said, oh, maybe we should start doing it. So I think that you just have to be careful, a lot more careful, because you have so much more access to so much more information,
Mhm.
but not everyone has it, right? If
Yeah.
you live in a country that doesn't have internet, or you don't have easily accessible internet or even electricity, then how can you have internet if you don't have electricity? But there's still places around the world that are like that.
Yeah.
And so I mean, I think globally for other initiatives beyond health is access to electricity, access to clean water, access to sewer systems where, there are some places in the world where they're still going in outhouses or in the ground and they
Yeah.
don't really have clean. And the problem is when you have sewage in the ground, it contaminates the water supply. So then you're contaminating your water supply. So clean water, energy, like electricity, food, access to food, and like fruits and vegetables and meats. It's so easy for us in America because guess what? Well, you can just go to the grocery store, go to Fresh Market or Publix, and walk down the aisle, and you can get anything you want, and it has plenty of nutrition. You can go to how many restaurants do you pass on your way to school? Tons,
Yeah.
and you can go there and get food. That's not the case in other
In
countries,
other
and
countries, people
so
don't have
so
as much as we do.
yeah. So I'm not saying that every country needs to be like us by any means, but they need to have access to those things that can allow them to have a chance in life, to be successful and to be healthy. And not everyone has that. So I mean,
Yeah.
it's amazing that clean water is still a problem some places in this world. So
I'd like to say, before I end, going back to what you said on that question, it really caught my eye when you were talking about America and how like you've been saying that we have a lot of things that other countries don't, and we have a big influence on we're very influenced on technology, and we're getting fatter too because we have accessibility to all of this food too. And again, other countries don't have that compared to us. We rely on technology so much, and it has so much of an influence on us. I mean, I'm talking to you through Zoom right now. That's technology. Um, but we rely on it so much that we're less spending time outdoors. I mean, yeah, we're meeting people online. Um, but like you said, are they really your friends? From my standpoint, as a teenager, if there's any say to that, I would say that your just real friends are the people in real life. And I think that's kind of obvious too. But like the people who you're close with and you share relationships with. There's some people out there on like when you're playing video games, let's say, that you've never seen their face. You can't really call them a friend because you don't hang out with them. So I loved how you were talking about that. But those are pretty much all the questions I can ask you right now before we run out of time. So
All
I
right.
thank you for your thank you for your time, Dad, and
Thank you.
thank you for all of the viewers who are going to be watching this. Hopefully we get better on this. Maybe we can work on the audio. Just give the podcast any tips on what we can do to make it better. Um, really thank you guys. Hope you guys can bear with me for the through the first episode. So and if you guys enjoyed it, thank you. Um, but Dad, again, thank you so much for doing this with me. And yeah, that's it.
All right. Thanks, Liam.